I'll have you see, I do drink water. You see my big ass stein here? It's water, not vodka, water. You see that, Jose?
You only drink one of those and then the rest are monsters.
I drink water too. Like, if I was to show you my screen, you can see all my water bottles. That's all I drink.
No, I just, who was it? Oh, Ricardo. See, Ricardo, I drink water too.
Nice.
Yep. This is about how much water a day you should be drinking. So I'm halfway there in just 30 seconds. Half of my daily intake. All right. So now, moving on. And I'm moving on. Oh, eastbound and down. A little music to get us in the mood. I don't know where the microphone is. Holy cow, I knew I didn't miss him. How about Lydia? Did you miss me?
Yeah.
I don't know if I should tell you this. You'll probably get mad at me.
What?
Guess who passed registry?
Hector.
Yep.
Yeah, he told me.
Oh, I'm sure he did. I'm glad he did, but I didn't expect it.
Am I the only one that hasn't passed?
From your class, no, actually, so Diego did. Richie didn't.
Really?
Yeah, and he failed it once, and now he's working out in the oil fields in like Midland or something. He kind of got disillusioned. And then you know who else failed it? Michael.
Who? No way, really?
Yeah, but you know what his problem was? I bet you that he was trying to analyze every single question. Remember how he used to do it?
Yeah.
He has that doctor mind. So I think he overthought the questions, and that's why he.
Yeah.
So that's why I say just look at the question, answer it, don't put anything in it. You know that's what he used to do.
Yeah.
So guys, that serves as a lesson to you. Don't put anything in a question. Don't overanalyze it. Don't second guess yourself. That kid talking about who was the valedictorian? Oh, Diego was the valedictorian in your class, right? Yeah. Had a kid really smart. He's gonna be a doctor. All right. He is really, really smart. But he's kind of those that he's the smartest or the dumbest smart guy you've ever met. In the way that he overanalyzes everything. And he would put things into questions and he'd always be arguing the questions with me. It's like, dude, no, it's not in there. No, but what about this? I thought about, no, that's not in there. And the shyest guy in the class, who I remember, I told him, I'm going to get you out of your shell. You know what his smart aleck response was? Do you remember what he said, Valeria?
No.
He said, many have tried. And you know what? I got him out of his shell. To the end, it's like I wanted to strangle him. But he works for Dominion now. I knew that'd get you riled up, Vanessa. No, but his dad works at Dominion. I don't know if you know him, Mike Tellis. No, he's one of the supervisors over at Dominion. His dad works there. So His mom's pretty cool too. Anyway, so going back, so eastbound and down, we're trucking down the highway into asthma. So, my nose, my nostrils are flaring. I'm tripoding. So what's happening inside my body? Why am I going through all that stuff? Don't make me pick out names. Huh?
There's chest tightness.
From what?
Bronchial constriction.
Okay, bronchial constriction and what else?
From the bronchioles being how do you say that when they're, hold on.
I'm holding. What am I holding?
When the airway, like when it's like it's the swelling, like it's
Okay, so the bronchioles are constricted, or the bronchial passageways are constricted. There's something there. And so what's causing that narrowing of the bronchial, or the lumen of the bronchial? And yeah, you could have bronchial constriction because the smooth muscle is contracting.
You have swelling of the airways.
Okay, but what's causing that? Well, no, the airways aren't getting swollen. The airways are getting constricted. They're getting smaller.
Is it because of the irritants and allergens?
Okay, so allergens can set off asthma. What happens is there's a buildup of mucus or increased mucus production. So you have mucus plugs or just mucus. In other words, snot, but it's lung snot. And so it's there. And so the bronchioles, and there's a picture of it in your book.
Oh, the mucus plug and the. Okay.
And the mucus buildup. So that's causing air to be or the bronchioles are constricted, reducing the amount of air. So let's say you want to get home after class. You're here in the class and you want to get home. But I eliminate one door, and the other door, I narrow it down. So instead of nice rapid movement, I'm restricting the flow out. So what's going to happen to the exiting of you guys?
It's going to take longer to get out.
It's going to take longer to get the fuck out. And I want to go home and sleep or watch TV and stay up till 2 a.m. and then go to sleep and wake up at 6, 5. So, yeah. So there's a backup of students. So in the lungs, there's a backup of oxygen. Not enough oxygen is getting through those narrowed passageways to get to the alveoli. All right. Now, asthma attacks can be common with asthmatics. It's something they get, but they can get pretty severe. My little sister actually died from it, but they were able to bring her back, thankfully, because kids are hard to bring back from cardiac arrest, or at least she stopped breathing. I don't know if her heart stopped, but she stopped breathing, but they were able to get her back, thank God. So asthma attacks can get pretty severe. Adults have been known to die from asthma, severe asthma attacks. So there are allergens. So people that are people allergic to like dogs, cats, animals. It's the pet dander, grasses, pollen. that kind of stuff that exacerbates. Usually they're kids, and we call that extrinsic asthma. That's neither here nor there. And then the other one is intrinsic, which is usually adults. Kids get it too, but that's more from like infection or even exercise. And there's such a thing called exercise-induced asthma. So running around a lot, they get an asthma attack. So a lot of asthmatic patients have inhalers. What's that medication in the inhalers that they take?
Albuterol.
Albuterol. Oh, there's a couple others, but the most common is albuterol. Now, so I'm having an asthma attack. So what would you expect to find in me as far as the signs and symptoms?
Sneezing.
Wheezing,
Their posture,
what's the posture?
Tripod position.
the tripod.
Tripod. Someone besides Jose, I heard that first.
The nasal flaring.
Nasal flaring. Was that you, Vivian, that said tripod?
No, that was someone else.
Was that you, Valeria?
Yes.
Okay, good. See, I'm getting you out of your shell yet again.
I know.
All right, what else?
Pale, cool, clammy skin.
Pale, cold, clammy skin,
Fast heart rate.
tachycardia. Is that you, Kayla?
Mm-hmm.
Sweating.
All right, good. I'm sorry, what was that, Carlos?
Sweating.
Pale, cold, clammy skin.
Anxiety.
Anxiety.
Do they still get like this not this I don't want to say discoloration of the skin, but like when their nail beds get like purple or blue?
Yeah, the cyanosis, but again, remember,
Oh.
cyanosis is a late sign. And it can
Oh.
occur in the nail beds, it can occur in the mucous membranes around the lips.
Cough.
A cough, okay? Usually non-productive. Now, what are the things,
Like irritation on your throat.
okay, you get a little irritation, probably from coughing. And also albuterol can dry you out.
Could they be speaking in like shorter sentences?
Yes, that also is something that you'll find with really any type of respiratory distress. If they're in severe respiratory distress, listen to how they're talking. Look at, we kind of say words per sentence. So short word sentences.
Or like one word sentences.
Yeah, so it's like, I can't breathe. It hurts to breathe. You notice the pauses?
Mm-hmm.
So that's one thing that you'll have. So it's kind of typical. So let me ask you this. Do you want to be asking them a lot of questions?
No.
No.
No. Do you know the difference? Did we talk about the difference between open-ended and closed-ended questions?
Yes.
Okay.
Yeah.
What kind of questions do you want to be asking these patients?
Close in it.
Closed-ended.
They're just yes and no answers.
Yes, no. Yes, no.
Like yes and no questions.
Correct. What were you going to say, Kayla?
Oh, nothing.
I saw your name bold up and I heard something, and so I didn't want to not acknowledge it. All right. So somebody had said something I didn't quite catch. Who was it and what did they say? So I thought it was Kayla, but I guess not. So yeah, you want to ask them very simple yes/no questions. You don't want them to give out a dissertation when they're starving for air. That's a good way to think about it. And it's not just asthmatics, it's really any respiratory distress patient. They're starving for air. Okay, I was going to talk about albuterol. One of the things that albuterol does is not only opens up your bronchioles. Remember, what kind of medicine is it? What's the action?
Bronchodilator.
It's a bronchodilator. Right, good. So not only does it open up your bronchioles, but it also helps loosen up that phlegm. So after albuterol, you could have a productive cough because now you're trying to, or the lungs are trying to get rid of that mucus that's left over. Okay. All right. What else?
Like about the medication or?
Well, signs and symptoms of wheezing.
They're they're like exhausted.
Okay, why?
Because of the like they're using the.
Because they're working to breathe.
Mm-hmm.
Well, they're working to breathe, but remember, they're not getting enough oxygen. So eventually, that work of breathing is going to be decreased because they're not getting enough oxygen to create enough energy. So yeah, they're working to breathe.
Like they're overworking.
Yeah, it's just like when you've been working 14-hour days for 2 weeks straight. You're not going to have taken this whole week off, and I would have been fine without taking any vacation time. That's how many extra hours I put in the last pay period. So just remember, if you guys ride out with me, food, caffeine, sleep, and nicotine. I need to have those 4, otherwise I'm really grumpy.
Make sure you take your vacation
before then. We'll see. Remember, I could do online class from wherever. And I actually thought about doing it from Tucson, Friday's class. But I'm like, no, I think they want a break from me. All right. So are you noting, are you noting or noticing very many differences in the signs and symptoms of an asthmatic patient from any other respiratory distress patient?
Not really.
No.
Not really. Very few differences. Okay, so now, so we talked about the treatment of asthma, which was? So I'm having a hard time breathing. What are you gonna do for me?
Nebulizer, inhaler.
Okay.
O2.
And O2. What if I don't respond to that treatment? Okay, let me rephrase that then. What's the definition of status asthmaticus?
The word of what?
What is the definition of status asthmaticus?
Acute severe asthma.
Okay, give me more.
Like when you're not responding to the medication, so it's getting worse.
Okay, medication. Okay. All right. Yeah, I'll take that because it really is. They're not responding to the treatment, be it the medication. Well, yeah, oxygen is considered a medication as well. So they're not responding to the medication or treatment. All right, good. So if your patient does not respond to what you're doing for them, then we classify that as status asthmaticus. In other words, we need to get them the hell off the scene and to the hospital. Okay. So one of the things I want you guys to remember, and I told this to the to the day class also. And today we did scenarios and they kind of didn't think about it. In your medical history, and you have a patient having an asthma attack, a very, very important question to ask them is, have you ever been intubated? And the reason being is because if they've been intubated, that means that they get pretty severe. Okay, so ask them if they've ever been intubated. Okay. If they say yes, row. Diesel therapy to the hospital. Now, can you use CPAP on these patients?
Can we what?
Use CPAP on these patients.
Yes. Yes.
Yes, you can. Yes, you can. You need to give force that air into them. Okay. So any questions on asthma?
No.
No.
Okay. So who, Dylan, can tell me about pneumonia?
Like what?
What do you know about it?
It's usually caused by like cold weather, getting a lot of moisture into the lungs.
Okay. The big thing about pneumonia is that it is caused by an infection. This infection is very opportunistic. There are like a pneumococci bacteria, but it is a very opportunistic type of infection. In other words, it waits for your immune system to be depressed, to be low. So for example, if you've had the cold, or a cold or the flu, is your immune system going to be compromised? Yes, it is. And so you're at a greater risk of acquiring pneumonia. Other people, elderly, chronic conditions, immunosuppressed. In other words, they have HIV, AIDS, that they are cancer patients, or they are transplant recipients. They're at a higher risk of pneumonia because their immune system cannot fight off infections, or has difficulty fighting off infections. And so, for example, me with diabetes, I got a pneumonia vaccine, and I don't need to get a booster till I turn 65. So hopefully I'm good. Hopefully I live that long. But it's a bacteria virus that's going to affect the lower respiratory tract. Now, what is this lung sound that you will hear when the patient has pneumonia?
Crackle.
No.
I'm sorry, wheezing.
No.
Bronchi.
Bronchi. Remember, bronchi is typical of pneumonia. Now, what did I say is causing pneumonia?
An infection.
An infection. So what's the body's normal response to an infection?
Fever?
Fever. Good. Exactly. So the person, when you feel their skin, it's going to be warm. It's going to be hot because they have an infection. Now, can they have a cough?
Yes.
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 Right? They might have some mucus come up. So a productive. What do I mean when I say productive cough?
It brings up mucus.
Yeah, it brings up something. Other people call it a wet cough, but we call it a productive cough. So they're coughing up a lot. So what else do you think they might experience because of all the coughing?
Chest pain.
Chest pain. Good. Here's a little pearl for you guys. Whenever you have a patient complaining of shortness of breath, ask them if they also have chest pain. And if they say yes, ask them what came first, the chest pain or the shortness of breath. If they say the shortness of breath came first, then that chest pain probably is not cardiac related. Think about it. If you've been coughing a lot, are you going to have chest pain?
Yes.
Yeah. And people have been known to pop a lung from how hard they are coughing. Now they tell you this, that chest pain came first before the shortness of breath, then it's probably a cardiac event. Okay? Probably a cardiac event. What do you think their pulse ox is going to be?
Lower than 94, 90.
Yep. Probably lower than 94 because of what they call the infiltrate, where the infection is occurring. So that part of the lung, or the part of the alveoli in that part of the lung, let me rephrase that. The alveoli in that part of the lung are not able to perfuse adequately, or not able to have adequate respiration external. Yeah, you can have crackles, but you have to be careful. Most of the time, they're going to have bronchi, though. If they're not perfusing very well, what do you think their mental status is going to be?
Altered.
Altered. So how do we take care of a pneumonia patient?
You administer oxygen.
Okay. Pretty much the same way as any other respiratory patient. Yes. Remember shock? We talked about pulmonary embolism.
Yes.
So what's a pulmonary embolism?
Blood clot.
It's a blood clot. Where?
Lungs.
The lungs.
In the lungs. That's pulmonary. But where in the lungs is that clot located at?
In one of the pulmonary artery or one of the branches.
Okay. So what is it doing?
Blocking blood flow.
Good. It's blocking blood flow. So that means that some blood is not going to get oxygenated again. So what's happening to the amount of volume or the amount of blood, or what's happening to the amount of oxygenated blood going to the body?
Decreasing.
It's going to decrease. So Here's one where they might experience chest pain. What do you think is going to happen first? Chest pain or shortness of breath?
Chest pain.
Nope.
Shortness of breath.
Shortness of breath. Now describe it. Now describe it as having chest pain. Is this a sign of shock? Or is this a type of shock, shall I say?
Yes.
What kind?
Obstructive?
Okay. Why?
Because it's obstructing the blood flow?
Yeah, it's blocking the blood flow. Good. You guys remembered. All right. What kind of patients are prone to pulmonary embolism or emboli?
Wait, what was the question?
What type of patients are prone to pulmonary emboli?
Patients with CHF?
No.
Is it thin patients, like tall, thin patients?
That's more of the spontaneous pneumothorax.
Is it the older patients?
No. I mean, they can. How so? How so, Jose?
I didn't think that far.
Cardiac disturbances. In other words, there's an electrical conduction problem. Remember how the heartbeat originates in the SA node and it travels through the heart? Well, if something is going on, and the most common rhythm that it could develop in is what we call AFib or atrial fibrillation, that's going to cause blood to start clotting up because it's not getting pushed out adequately. And so a clot can build up in the blood in the atria, the right atria, and then all of a sudden it gets through into the right ventricle and then gets pushed out into the lungs. So in that respect, yes. Okay. What other type of patient or person is susceptible to a pulmonary embolism?
Somebody who just had surgery?
Somebody that just had surgery, yes. Who else?
Like if you've traveled on an airplane, like if you get a blood clot in your leg and it shoots up to the lung,
Can it just be airplanes?
or like a car.
Long distances, why?
Because they're sitting for a long time.
For prolonged sitting, so that's doing what?
Affecting the blood flow.
It's affecting the blood flow. By sitting, you're compressing blood vessels, and it restricts or impedes a little bit of blood flow, which can cause the blood to coagulate. So that's why I made sure I took my Plavix before I went on my trip, because I was sitting on my butt for long periods of time. And what do I do all day at work? I sit on my butt. It's kind of cool to get paid to sit on your butt. But then I'm also a free spirit, so I need to be out there and getting my hands dirty. Who else? Women on birth control, particularly if they smoke. All right. As a result of that clot that's backing up blood, will that back blood up into the right side of the heart?
Yes.
Yes, it can. So because of that clot, remember, it's impeding blood flow. So depending on how big the clot is and what part of the pulmonary artery it's on, it can back up blood into the right ventricle, then the right atrium, and then remember the superior vena cava. And where is the blood coming from that's going to the superior vena cava? So here, right? And then up here, and then what's this blood vessel? Can you see me?
Jugular vein.
The jugular vein. So that causes what?
JVD.
JVD. Jugular vein distension because of the buildup. Because of the buildup of pressure, it's going to put pressure up onto the jugular vein. Okay. What else? All right, anything else?
Like causes or?
Yes.
If you have like a clotting disorder?
Okay. Can alcohol and birth control cause clots?
Yes.
Yep.
Yes.
Okay. Any other signs, symptoms you can think of?
They cough up blood.
No, not necessarily. Because remember, this is in the circulatory system, not in the lung itself, per se.
Okay.
So how would you take care of me if I had a blood clot in my lung? Have flow 2, pray, get my ass to the hospital. You know what I do as a paramedic for a blood clot in the lung?
What?
O2, pray, and haul ass to the hospital. So, okay. We talked about fluid in the lung, and we'll talk more about it on Wednesday. But haven't we talked about CHF? Vivian, have we talked about CHF before?
I don't remember.
We have. Remember where the left ventricle fails, So blood is backing up into the left atrium and then it's backing up into the lungs, which causes fluid in the lungs.
Oh, yes.
So we'll talk more about this on Wednesday because of the heart failure. But we talked about fluid in the lung earlier, right? What does fluid not allow?
Oxygen to pass through.
How does it, what's another word for pass through?
Diffusion.
Perfusion.
No. I mean, it is the exchange of gases, but I used a different word earlier. You remember, Miss Kayla?
Mm,
Sounds like perfusion.
was it diffusion?
There you go. Remember, fluid does not diffuse oxygen. And what's in your lungs right now with pulmonary edema?
Fluid.
Fluid. Okay. So our treatment for a CHF patient, and there's going to be a few different signs and symptoms. We'll talk more about it on Wednesday. But there's fluid in the lungs, and there could be fluid. Remember, we just talked about JVD, but pulmonary edema with CHF is going to start from the left side of the heart. And so that fluid, we need to displace it. So what can we use to displace that fluid out of the alveoli?
CPAP.
CPAP. I was about to say, Miss Kayla, you mentioned it earlier. So there you go. So CPAP. Okay. O2, CPAP. So Miss Kayla, do you know somebody that suffered a spontaneous pneumothorax?
Not personally.
Okay. But you said something that is very, very true. So a spontaneous pneumothorax is basically a lung that collapses on its own. Doesn't mean that they were stabbed in the chest. It just means it collapsed on its own or collapsed on its own. Typically, tall, slender, Caucasian males are very prone to spontaneous pneumothorax. Why? I don't know. They don't know. That's why it's called the spontaneous pneumothorax. It just occurs.
Wait, who?
Tall, slender Caucasian males, or young, tall, slender Caucasian males. In other words, tall, skinny white boys. I was speaking slang there for a second. What? It's true.
Oh gosh.
What?
I was gonna say something, but never mind.
Why not?
I knew there was a reason why I didn't like them.
Oh. You only have to worry if you marry him.
True. Yes, you're right.
Yeah, if you marry him. Because remember, it's for better or worse in sickness and in health.
That's why it's 2020, Lou. You write your own thing.
I'm old. And I've never done it, so I couldn't tell you. I don't know. Other people that can get a spontaneous pneumothorax is if they exert themselves too much, like lifting a very heavy thing and they exert themselves, put added pressure in the chest and the thorax, can cause a pneumothorax, spontaneous pneumothorax. Can also cause a hernia, but here we're talking about pneumothorax. Oh, besides you're short, so I could see the other reason why. No?
What?
Nothing. What? So if I have collapsed lung, what would you expect to find in me?
In you?
Now, uh-huh.
In you?
Yeah, I'm the patient. And I'm having a hard time breathing.
You have a collapsed lung.
And I have a collapsed lung. What would you expect to find?
Fluid?
Mm-mm. Remember, it's a collapsed lung.
Will be decreased breath sounds on one side.
There you go. Because it's collapsed, the lung is not expanding and getting any air. So you'll have diminished or absent lung sounds on the affected side. What else? Because I only have one lung, what do you think?
Shoulder pain?
Shortness of breath?
Yeah, you may, and that could be because of yeah, you may have shoulder pain, but I'm sorry, what was the other answer?
Shortness of breath?
Shortness of breath, yeah.
Unequal chest rise and fall.
Okay. Yeah, because only one lung's getting blown up. Okay, so rapid breathing, sweaty, pale. We already know why that is. So how would you take care of me?
Oxygen?
There you go. What else? Rapid transport? Maybe positive pressure ventilation?
CPAP.
CPAP. Okay. Mm. Okay. Uh, so I just broke up with a girlfriend. And I think about her and oh my gosh, how am I gonna live without her? And I start what am I doing?
Hyperventilating
Okay, from what?
from having a panic attack.
Okay. Because how am I gonna live without her? I can't live. I'm so depressed.
Your emotions.
Yeah. Nah, I just made all that up. I like role playing, I haven't noticed. And so I'm hyperventilating. So what am I doing?
Breathing fast.
I'm breathing fast. But what else am I doing without breathing fast? what am I getting? What am I doing? Or what am I doing more of?
You're releasing too much carbon dioxide.
Okay. So my carbon dioxide level is going to be
Low.
low. So a little advanced for Wednesday. A woman of childbearing age complaining of chest pain. Now this is based on my experience. And I'm looking at you guys. A woman of childbearing age complaining of chest pain. It is rare for them to be having a cardiac event. Not to say that they can't, but it's rare. In my experience, 20 years, this month actually marks 20 years. Probably right around these days, I don't remember. But this month marks 20 years that I've been a paramedic. In those 20 years and the 2 years before that as an EMT, whenever I've had a chest pain patient of a woman of childbearing age, 99.9% of the time, the problem was a panic attack. So that means that a panic or hyperventilation syndrome can cause chest pain. So you want to ask about any stressors, anything going on lately that would cause you to be worried. Money, family, husband, boyfriend, although on the other side too, wife, girlfriend, both, 3 of them if you have more than one of each. Kids, you can't kill them. You got to take care of them until they're 18. They're a good tax write-off from what I hear. Work. Some, or lack thereof. Something's causing you to have an anxiety attack or a panic attack. Okay. What was I going to say? That's usually the cause of the chest pain. A woman, childbearing age, complaining of chest pain. But a guy can also freak out, or I'm sorry, could have an anxiety panic attack causing them to hyperventilate. What you'll see in questions to ask is any tingling around the mouth, or numbness and tingling around the mouth, the hands or the feet. Those are a little bit more typical. The other thing you might see is what we call carpal pedal spasms. In other words, the hands, they can be clenched like this. Their toes might even curl up. And we call that carpal pedal spasm because of the low carbon dioxide level in the body. Okay. Obviously, they're breathing fast. What do you think the heart rate's going to be?
Fast.
Fast. Might they feel dizzy?
Yes.
Yep. They could be nervous. They could be anxious, and that could be causing the issue. So that's what they're going through. So back in the day, we used to give them a paper bag to blow into, to inhale some of that excess blown off carbon dioxide. We don't do that anymore. Okay. Give them oxygen if you need to, but the best thing is number one, remove them from the stressor. In other words, if it's the significant other that's causing them to have an anxiety attack, get that significant other out of the room. Get them away from whatever's causing them to have that anxiety panic attack that's causing them to hyperventilate. Number one. Number two, talk to them. Get them to calm down. Talk to them calm. All right. This is the technique I use, and this is the technique we teach. It's not necessarily the talk down technique, which we'll talk about later, but you just have them, all right, just relax, calm down, slow your breathing. Breathe with me. Take a breath in, let it out. Deep breath in, let it out. Breathe in, let it out. So coach them through the breathing. If they start going a little bit crazy, get them back on track. So it's going to take a little bit of work. Okay? A little bit of work. We'll talk about epiglottitis when we talk about kids, so I'm not so worried about it right now. Pertussis is also a childhood disease primarily. Cystic fibrosis is, just so you're familiar with it, but that's a hereditary disease that causes a lot of very thick and sticky mucus within the lungs. So they have respiratory issues. Unfortunately, patients with cystic fibrosis only live to about their 20s or 30s. So they die young, okay? So there is a gene that causes that illness. So expect them to have a lot of mucus in their lungs, coughing up a lot. So a productive cough. And a few other things. To be honest, in all the years I've been doing this, I've never had a cystic fibrosis patient. Not to say that you won't, but for the most part, remember they're having a respiratory issue. So really it's to help alleviate some of their symptoms. They're having a hard time breathing. So what do we do for that? We give them oxygen. Although we can give it to them by nasal cannula. Transport to the hospital. There's really not much. I mean, you could give them some sterile water or normal saline to the nebulizer to kind of moisten them up a little bit.
I was gonna ask you with that one, since they have like mucus lining on the like in their lungs, like you can't give them albuterol to loosen up that mucus.
No. I mean, it's there. It's getting dislodged. It's just there's a lot of mucus there.
Okay.
So yeah, usually no. We haven't talked. We talked about poisonings? No.
Just that one
No.
time with the cop. What? Will team size up and stuff?
Okay. I don't want to get too much into it because we'll cover it more when we get to poisonings. But just remember, if you inhale poisons, goes into the lungs, that can damage the lungs. It can cause fluid buildup. It can cause destruction of the lungs.
Is there anything you can do to like push it out?
A little bit. For some smoke inhalation, you can use a demand valve to force the oxygen into the alveoli. But there's others that know you just got to give them oxygen and get them out into the fresh air. Again, I don't want to spend too much time on it because we will cover it with poisonings. So, and you'll see it will make a lot more sense. But you could read over it, review it. Somebody did mention carbon monoxide, and that is the most common gas that's out there. The problem with carbon monoxide, it's colorless and odorless. Now, in your homes, do you have carbon monoxide detectors? Don't look up.
Yes.
That's exactly what I did.
Uh-huh. I lived in an apartment. The last apartment I was living at before moving in with my mom, and they had the carbon monoxide detector up, and I took it down and put it on the ground, and then they put it back up. And I even told the lady, the manager was like, "No, carbon monoxide detector should not be up. It needs to be down low to the ground." Why? Miss Vivian, Miss Firefighter, tell me why.
Because it doesn't. It's like when you have hot air, it goes or wait, no, I'm thinking of something else. So it stays low, like to the ground.
Yeah, it stays low to the ground, but why?
Oh, I just know it stays low to the ground.
Because carbon monoxide is heavier than air. So where would you find a carbon monoxide detector? Where should you find a carbon monoxide detector?
Like in the outlet. Well, it depends because like there's some that you plug into the wall,
Uh-huh.
and it's like you put it in an outlet. Like mine, like it's in the kitchen, but
Why
it's
the
like
kitchen?
because that's where the oven, the stove is, and all that.
That's more natural gas or propane, depending on where you live.
Well, yeah, but it's still closer to like.
If you have an attached garage, it should be near your garage door or the entry to the garage. And then also, if you have a fireplace, it should be near the fireplace.
It's near the door.
What door?
Oh, from my house.
Yeah.
So like, how you said like near like the garage, like since we don't have one, like we park our cars in the back where the kitchen area is.
Okay.
So it's near that door.
Yeah, remember car exhaust contains carbon monoxide. And then fireplaces, if it's a wood burning, natural fireplace, burning wood is going to release carbon monoxide. So if your flue is, not only is your house going to fill up with smoke, but it can also back up carbon monoxide. Why is carbon monoxide bad for your body?
Because you can like suffocate
Why?
because it triggers like the lungs, the heart, and the brain.
Nope. Well, it does, but here's the thing. How does blood get around the body? Did we already forget how oxygen gets around the body?
Through the red blood cells.
Thank you. Through the red blood cells. Now, how do they hitch a ride? And don't say they thumb it, because they don't. They buy a ticket. What's the ticket?
Is it the hemoglobin?
Yeah. How many hemoglobin receptor sites are there on the red blood cell?
4.
4. All right. And so what helps the oxygen bind to the hemoglobin?
Can you repeat it?
What helps oxygen bind to the hemoglobin? Iron. Iron. Anyway, so the oxygen binds to the hemoglobin, the 4 receptor sites. Now, you throw in carbon monoxide has a greater attraction to the hemoglobin than oxygen does. So now oxygen is the third wheel. Damn, hemoglobin cheating on oxygen with carbon monoxide. Damn the nerve. I want to break up. Oh wait, I can't. I need oxygen. But right now I like carbon monoxide better. They're cuter. I think, I don't know, but so that greater propensity. So is the body using that carbon, or is it using that oxygen? No. Because it's not going in on the hemoglobin. So what's happening to your body?
It's not getting oxygen.
Yeah, it's not getting oxygen. So as a result, what happens to us?
You start to suffocate.
Yeah. We're not producing energy. Anaerobic metabolism. Sodium potassium pump fails. The cell dies. Next cell dies. Next cell dies. Millions and millions of times, or millions and millions of cells die, and then we die. So is that a bad thing?
Yes.
Yes.
It is. So what did I say initially about carbon monoxide? It's a colorless, odorless gas. So do you know if you're inhaling carbon monoxide?
No.
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 One of the signs is a headache. Another sign is drowsiness. Another sign is death. I hate to laugh about it. But if people are sleeping and they've been inhaling carbon monoxide, they will never wake up. That happened to a family in East LA years ago, and I was working out there. A dad and like 3 or 4 of his daughters died overnight inhaling carbon monoxide. They had like a space heater or something, and they died. There was another story, and I was worried not this past winter, but the winter before. I'd gone up to Albuquerque to gamble, and on the way back, actually on the way up, it started snowing. So we were there quite a few hours. We were coming back overnight, and it was snowing pretty hard, and I couldn't see very well. The roads weren't the best to drive in, so I pulled off to a rest area. I wasn't sleeping very well because I was worried about all that snowfall. Because there was a story where there was a group of friends that had gone up to the mountains and they pulled off to the side of the road. Well, it'd been snowing and they wanted to stay warm, so they kept the engine running. Well, the snow accumulated on the ground and up and up and up until it covered the tailpipe. What do you think happened to that smoke, to that exhaust? It hotboxed it.
They got clogged.
Yeah, it got clogged, and it started backing up inside the passenger compartment. They were asleep. They didn't notice. They died. Now, remember I told you guys about pulse oxes being fallible? Did I tell you guys that?
Mm-hmm.
Yeah, we were talking about nail polish last week, right?
Yes.
Okay. What's the person's oxygen level that's suffering from carbon monoxide poisoning? Are they hypoxic?
Yes.
No, they're not. Remember, there's oxygen in their body. They're not suffering from a lack of oxygen because not enough is going in. It is. It's just that the carbon monoxide has a greater propensity to, or greater attraction to the hemoglobin than oxygen does. So it doesn't let it get on. So when you put them on the pulse ox, what do you think the readings is going to be?
Normal. High.
Yeah, normal to high. Remember, it's measuring how red the light is on the other end. So what do you think their skin color is going to be?
Regular.
Yeah, there could be bright red. Cherry red. So one of the things for treatment is you get them out of the environment, get them breathing fresh air. Like I said, you could use a demand valve, but not a lot of agencies carry demand valves anymore. They might need a hyperbaric chamber to help push oxygen into their body. So you need to get it out in the environment. Have them stop breathing in that carbon monoxide. Okay. Questions on that? And like I said, other gases we'll talk about when we get to poisonings. Okay. All right. As far as the viral illnesses, remember there are illnesses caused by a virus. So what do infections do?
Bring on a fever.
Fever. Yep. And this is these are respiratory viruses. So what else are you going to have?
Shortness of breath.
Shortness of breath. Good. What else? Tripoding, nasal flaring, accessory muscle use, tachycardia, tachypnea. Are you seeing the trend here?
Yes.
You might have a productive cough, fever, chills. So the big takeaway from respiratory distress is a lot of the illnesses share a lot of the same signs and symptoms. The person is needing to get oxygen, the body's trying to compensate for that lack of oxygen. So you're going to see a lot of similar signs and symptoms. There are some that are particular to certain conditions, but overall, they need help breathing. That's where we come in. And that's where chapter, what was it? 14, airway management. Was that the chapter? 13. No, 12. 13. I think 13. I forget. It's been a while. But that's where it comes in. Okay. So now I want you to remember, I'm a little kid. No comments from the peanut gallery. Joanna. I'm a little kid. Do I do respiratory issues very well?
Yes.
I will for a period of time. Here's the problem. As a little kid, I lean on my respiratory drive to help me. My body's not developed yet to really use my cardiovascular system. So my respiratory will compensate. My body can compensate very well. However, I'm going to decompensate very, very quickly. That's the bad thing. We don't want our pediatric patients to decompensate. In other words, for their little bodies to give up. It is not a good thing. The number one cause of cardiac arrest amongst kids is respiratory issues. So if you have a kid with respiratory issues, you have to be aggressive about the treatment. Don't dilly-dally, don't, no. Be aggressive with your management of a pediatric respiratory patient. Now, who can I pick on? Somebody, Jose, I mean, why did I even have to think about it hard? So Jose, he's an old man. Remember when we talked about lifespan development? Give me some of the changes that occur with age.
Like to everybody, or is it specifically just to me?
Well, no, you're the patient, so anybody can answer.
Okay.
You're just the old man. I'm not going to be the old man here. I was the kid.
His blood pressure changes.
Okay. So it can be caused by it could be caused by CHF that's causing those respiratory issues. It could be other cardiac issues. What else? What about a pulmonary issue? What happens to the elasticity of villi as we get older?
Decreases.
It decreases. What about the junk that we've inhaled over the years? What happens to that? And I don't mean cigarette smoke. I know.
I'm sorry, what?
I said, what happens with all that junk that we inhale over the years? And I didn't mean cigarette smoke.
Wears down the lungs.
Yeah, it builds up in the lungs, right? And so now we're going to have other issues. The lining of the lungs get affected and a bunch of other stuff. So are they able to have good breathing results? The answer is no.
No.
Loss of lung elasticity, loss of surface area in the alveoli, buildup of gunk in the lungs, in the airway. Muscles start to lose elasticity, so it can't fully expand the chest. More gunk builds up, so we can't cough it all out, but we can have a chronic cough. Blah, 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 blah. So really, we look at the scene with elderly patients, look at the meds they're taking. With kids, yeah, they might have respiratory issues they might have respiratory issues such as asthma. They've been sick. Elderly, look at the medicines that they take. Do you see a lot of differences in the signs and symptoms between a pediatric patient and a geriatric patient? No, right? Now, one thing about kids, when you transport a pediatric patient, have the caretaker in the back with you. Because for those of you that have kids, how much do they enjoy being away from their parents? Now, I'm talking about little kids. I'm not talking about teenagers. Teenagers love that stuff, right? Right, Brisa?
What was that? I'm sorry.
I said teenagers love being away from their parents.
Not really.
No?
Not me.
Okay. Well, some teenagers do. Do small children like to be away from their parents? Andrew?
No.
No, they don't. What are they going to do?
Well, from experience, they're usually like side by side 24/7.
Yep. One thing they'll do is they'll pierce your eardrums from the screaming and the crying. Now, don't get me wrong. When I'm at work, I want to hear a kid be a little pest. I want to hear them cry. Why? Believe me, I don't like hearing kids cry. Huh?
So you're not a breathe.
I'm sorry. Go ahead, Brisa.
Because that's what they usually do. Like, that's how they respond.
Yeah, also it means that they're fine, that they're normal. It's the quiet kids that I worry about. Especially if they should be crying and they're not crying. That's a bad sign. Or poor effort in the crying. How much effort was in that? Why are you laughing at me, Miss Ina?
You know what? I'm enjoying class today. It's different.
Well, there's two reasons for that, and we're almost done. That's why I'm kind of taking a little bit of time. Two things with that. Number one is because I took a break. Like I told you guys on Friday, No, on Wednesday, I told you guys that, I was burned out, and I know myself well enough that I know where I'm burned out, and a couple of you noticed it. So I needed that break. Number two is we're not so far ahead where you guys are going to be too far behind where you're like, oh my God, I can't continue. I need a drop. Okay. I think we're at the point where we can still recuperate some stuff. Because we're pretty much done with all the foundational stuff. Now we're down in the meat and potatoes of everything. Now it's teach me what I need to know. You have a patient that's having a hard time breathing. What do you do for them? You treat them. Give them oxygen, give them albuterol, whatever the other medications you could assist with. It's what you want to do. Do you agree about the boring stuff or the foundational stuff? And now we're in the exciting stuff?
Yeah.
Yeah, and I did notice, believe me, I was on, I don't know if you guys noticed on Friday, I was actually logged on while you guys were taking your test and at the beginning of the review. Did you guys notice that?
Nope.
Yes. You were showing us pictures of your dinner.
Yep. Yeah, I had just logged off when I did that. Although it was cold because I got it at 5 o'clock, Tucson time, so it's 6 o'clock. And you guys were done at 7, so the picture came in at like a little after 7. So my in and out got cold, but it was still good. But I made up for the next day. So I kind of felt like a change of tact was important because not too many people passed the test, and a lot of people didn't do so hot. So if I could change things up to get you guys more involved and kind of explain it a little bit different, I think that you guys will take more interest in the class and do better.
You know what happened? I mean, like, for me, I put a little sticker next to like the time.
Yeah.
Well, that was a fail. I was trying not to worry about the time because honestly, I that's one of my big issues. So I was taking my sweet ass time reading the questions. And next thing you know, I'm like, I think I only went up to like not even past 25 questions.
So what I'm going to do.
Did you have a chance to look at them and see if any of them were going to give us points back?
No. I mean, I looked at the first couple of them, and that's one reason I logged on was to see how Paul was going to do his review.
Yeah, his was a little different. He went through every question.
Yeah, and he's like number 3. Like most everybody got that one right. Yet he's going over. It's like I'm thinking to myself, he doesn't need to go over that one. And I think I even sent him a message saying, "Hey, this number of people got it right," but I didn't want to do too much.
I think it was a good idea, even though we got it right, or some of us got it right, for him to review it because not everybody got it right, and whoever didn't, that review probably helped them.
But here's the other thing too is make an appointment with me and come in and I'll go over your test with you. And what I do there, because it's hard to do, I don't want to show everybody's on here, but I'll go through your test with you. And I look at the ones you got wrong, and then we talk about that one. So it's not just the ones that everybody missed or majority of the class missed. It's specifically to your exam. And so I'm spending a little bit more time in the office. So just make an appointment with me and I'll be happy to go over the test with you. So, unfortunately, Monday actually. Monday and Wednesday are light days. In other words, it shouldn't be all class long. And if you guys want to do this, we're half Monday, half on Wednesday, I could definitely do this on both days where I will go over questions with you. I'll put up that LC Ready, that EMT review, and kind of have a little competition and go over questions with you guys to review. Sound good?
Yes, sir.
All right.
Lou, how many students are there in total in our class?
18.
18?
Yeah. Somebody dropped last week.
And then you said 9 per day, or because I have 10 people signed up for Monday. Is that okay? And then it would be 1, 2, 3, 4, 5, 6, 7, 8 or 9 if I get a response from the last person for Wednesday. Counting.
Can you send me a text and let me know who that last person is?
Okay.
Can we take food?
Yeah.
Hey Lou, I have like a question. So, you know how like we could like on Monday we'll have like, or you know how sometimes you have like a quiz for us to do before like class?
Yeah, you guys still log on to, I'll send you guys the link. I'll send everybody the link and you just log on and take the quiz.
No, like this is just a suggestion. Like what if we try like Kahoot or something like to review some stuff? I don't know. It's just like a suggestion.
Yeah, I'm familiar with Kahoot. The only thing is it's time intensive to put in the questions.
Okay.
So if we go on Monday, on Wednesday, are we doing online or how does that work?
Yeah, if you come to class on Monday, then Wednesday you log in.
Okay.
And if you come on Wednesday, Monday you log in.
Gotcha.
This is starting next week, right?
Yes.
Well, I'm excited.
Oh, good. So to finish off the chapter, if you look, we've pretty much talked about assessment and treatment for all these conditions, have we not?
Yes.
Or most of them. The only one I didn't talk about was pulsus paradoxus, and that's just a change in blood pressure with breathing. So other than that, so just remember the pathophysiology. Just remember the person is needing oxygen, and there's something that's causing the body not to get enough oxygen. So there's all those conditions. Okay. What else? I think that's it. So the importance of respiratory emergencies is the fact that we need to get oxygen to our body in order for us to live. When a patient has an issue with a respiratory, with obtaining that oxygen, the body's going to let us know. You will see the changes. But just like with anything else involving work, we get tired. We want to avoid the patient getting to that point. So our job as EMTs is to assist the patient in not getting tired. Once they get tired, it is a very important job to oxygenate that patient. And we've already talked about airway management. We could bag them. We could put a non-rebreather on them. We could put a nasal cannula. We need to ask the questions. Okay, we need to ask the questions. So, any questions from you?
No, sir.
Any comments from you?
No.
When's our next test?
When you go.
The 29th.
Oh, never mind. There's one more.
See, no, the 29th.
26th.
Oh shit.
It's a Friday. So yeah, next Friday.
And when are you gonna open up the retake for this last one?
Tomorrow. Actually, I'll do it right now. So I still got you guys on for another 4 minutes. I'm mean, aren't I?
Nah, not really.
No?
No.
Well, not today?
Yeah.
Are we gonna have a skills day anytime soon?
Nope.
Okay.
Um,
On the days we go in, are we wearing uniform?
yes. July 8th is the next skills day.
The what?
July 8th is the next skills day.
So we start going into class next week, right? I don't
Yes,
wanna show
ma'am.
up on-
If you want to come in on Wednesday and hang out here with me, you're more than welcome to.
Okay, cool.
What can I? You guys just took 7 and 8, right?
See.
Could have sworn I had one that was less. Oh, here it is. Oh, no. All right, I won't keep you any longer. I got to do a couple things. I'll finish it up. So we'll be open tonight, starting at 10. Actually, give me about 10:10 or so. And it'll be open until next Friday. Make sure you do your homework.
Yes, sir.
All right. Anybody have anything else?
Nope.
No, thank you.
No, sir.
So with that, you guys have a wonderful evening, and I will see you on Wednesday. And like I said, Ina, if you want to come on over, more than merry. All righty.
Yes,
Alright,
sir.
thank you.
All right.
Yeah,
You guys have a wonderful evening, and see you on Wednesday.
Bye.
Bye.
Bye, everybody.